Hey everybody, I just wanted to quickly go over this parathyroid hormone, osteoporosis, and calcium homeostasis Pogel exercise. So everybody's on the same page. So the first question says, discuss T-scores. Can negative T-scores be considered normal? So you can see greater than -1 is normal bone density. Between -1 and -2.5 is early signs of osteoporosis. So if you're between -1 and 0, that's still normal. So even if you're in like -0.5, -0.8, so that's still considered normal. So negative T-scores can be considered more normal. Suzanne has a T-score of -3.6 in her bone mineral density test. So that puts her at less than -2.5. So that shows she has some pretty significant signs of osteoporosis. Okay. And then if we look at things in her blood tests that are in the normal range or above the normal range or below the normal range, excuse me, we can see that parathyroid hormone is normally 10 to 65 picograms per mil. So she's quite a bit outside that range at 128 picograms per mil. She's a little bit above the normal range for calcitonin at 11.7 milligrams per deciliter, a little high there. And the normal range is less than 6.4 picograms per mil of calcitonin. And so we can see, so these two are above the normal range. This one, calcitonin, is within the normal range. It's supposed to be low. And then below the normal range, nothing here is actually below. So we can see, without looking at anything here, with what, at least in Suzanne's case, when she has high parathyroid hormone, she also has high blood plasma calcium levels, blood calcium levels. Okay, so looking at osteoporosis here, so we've got normal bone, and then we've got osteoporotic bone. So we can see there's less of these trabeculae, so less of this bone tissue. So there's less osseous tissue, and there's bigger pores. There's more air space, more fluid space. So less bone tissue, bigger pores. Two differences between the normal bone and the osteoporotic bone. So you can see the definition of osteoporosis is less bone density. So there's less osseous tissue per square unit, whatever millimeter, centimeter. So there's less dense bone tissue. Question 7 says, which of the following explanation do you think is most accurate based on information? Why? A, Suzanne fell, which caused her hip to break. B, Suzanne's hip broke, causing her to fall. Well, she has osteoporosis, which makes it more likely that her bones will break if stresses are put on them. Usually just day-to-day walking around, people won't just spontaneously break their bones. But if you put some kind of bigger stressor on that hip or that other bone by falling can put quite a bit of strain and pressure on bones. That's most likely what's going to cause the break. And her bone density is lower than normal, so it's more likely to break during a fall like this. Okay, so if you read through this paragraph, you can see that parathyroid hormone is released when blood calcium is low. So parathyroid hormone is released when blood calcium is low. It affects the osteoclasts. Osteoclasts digest bone matrix, and that increases blood calcium. So parathyroid hormone acts to increase blood calcium. And because the osteoclasts are digesting bone matrix, taking it away from the bone, they're decreasing bone calcium slightly. So we have been asked to create a diagram of negative feedback that illustrates the variable being regulated, the sensor. In this case, the sensor is also the integrator and the effector. Okay, so let's take a look at what we've written here. So calcium is important in cardiac function and signaling within the nervous system. The primary hormone utilized to regulate the levels of calcium circulating in our blood is parathyroid hormone, also called PTH. There's a group of small glands called parathyroid glands on the backside of the thyroid gland in your throat. The parathyroid gland senses calcium levels and adjusts its secretion rate of PTH. PTH indirectly stimulates osteoclasts, the bone pruners, in order to increase blood calcium. Okay, I had to step out to help some students in the lab. So what we're talking about here. So in this case, the variable that's being regulated is obviously blood calcium levels, plasma calcium levels. And so it is falling in this case. So blood plasma levels are falling. And so we have cells in the parathyroid gland that sense the calcium levels. So the parathyroid gland is the receptor or sensor. Then we have other cells in the parathyroid gland that take that information and do something. They integrate the information and they secrete parathyroid hormone. So the parathyroid gland is the sensor and the integrator. And the parathyroid hormone stimulates your osteoclasts. Those are your effectors. So bone is the effector tissue. The osteoclasts are the cells that do things in response to the parathyroid hormone. And the response then is increasing blood calcium levels. Okay. So Suzanne's blood test indicates a condition called hyperparathyroidism. So if her body is secreting too much parathyroid hormone, PTH, that's going to be activating her osteoclasts. So it's out of balance. So she's basically, her body's digesting more bone matrix than it's laying down. So her hyperparathyroidism is contributing to generating that osteoporosis. So hyperparathyroidism can be a risk factor for having osteoporosis, as you can see in this young woman here. So some other things that are risk factors are age, and I'll just pull up a website here because it very nicely illustrates lots of different osteoporosis risk factors. So genetics, having a family history of osteoporosis, smoking, alcohol use, not doing weight-bearing exercise, being a small person or a thin person, not consuming calcium and vitamin D, being hyperthyroid or hyperparathyroid, taking certain medicines like corticosteroids, having surgeries like ovaries removed, being of European or Asian ancestry, being inactive or bedridden, excessive dieting, or if you are an active enough female athlete that you've changed your menstrual cycle or became amenorrheic, that can influence osteoporosis either as well. Age, so if you're older, if you're female, if you have gone through menopause and you have lower levels of estrogen, estrogen has a protective effect against bone loss. And so women who are postmenopausal are a big risk group for osteoporosis. So things you can change, you can't change your genetics. You can choose whether to smoke or not. You can choose your level of alcohol use. You can, if you have osteoporosis or at risk of osteoporosis, you can actively take up weight-bearing exercise. You can't change much about being petite or small framed or thin. You can change your diet. You can seek medical treatment for things like hyperthyroidism or hyperparathyroidism, but that's not something you can change on your own. And you can look for alternative medicines if they are causing osteoporosis. So you can't change your genetics, but you can change your activity levels and your things, your diet. Those are the main things that have to do with that particular POGL exercise. Let me know if you have any other questions.